Hello, I am Dr. Srujan Dasyam, consultant gastroenterologist, Nulife Gastro. Today we will discuss about Crohn's disease. So what is Crohn's disease? Crohn's disease comes under a disease category called inflammatory bowel disease. So we must understand that inflammatory bowel disease is nothing but an inflammation or swelling or ulcers formation inside the intestine. In this inflammatory bowel disease, there are two broad categories of diseases, which is ulcerative colitis and Crohn's disease. Crohn's disease, which is different from ulcerative colitis in a way that it involves predominantly small bowel or small intestine, whereas in ulcerative colitis, typically the ulcer formations are more in the large intestine. Hence, the symptom complex is also different when it is compared to ulcerative colitis. So what is the prevalence or how common is Crohn's disease or IBD Crohn's? When it comes to general population studies, out of 1 lakh people, 5 to 10 per 1 lakh is the incidence of the Crohn's disease. So what are the causes of Crohn's disease? Crohn's disease is result of amalgamation of genetic as well as environmental factors playing together, which is causing disease over few years. So in which the patient is usually a genetically predisposed individual, that is, the patient has some bad genes which put the patient at higher risk for development of inflammatory bowel disease or Crohn's disease in the future. Then the environment plays here. So here, because of repeated gut infections or GIT infections, there is change in the normal bacterial flora of the intestine. So thereby our intestinal immune mechanism also changes. So over a long term period, because of this influence of the genetic as well as environmental factors in form of infections and diet. So here I would like to stress upon the fact that previously this inflammatory bowel disease spectrum of diseases, which is ulcerative colitis or Crohn's disease, they are considered to be disease of Western population, but it is not the same in last few decades, which is like last 1 or 2 decades. The incidence of IBD or Crohn's disease has also increased in Indian subcontinent. The reason being is there is more westernization of the diet and more incidence in intestinal infections or causing future development of Crohn's disease in case of genetically predisposed individual. So now let us see what are the symptoms of Crohn's disease. So as I said before, Crohn's disease typically affects small bowel or small intestine, which includes jejunum, ileum, and proximally it is duodenum. So the most common areas of Crohn's disease involvement are both jejunum as well as ileum. So when it is affecting the small intestine, it usually causes an ulcer formation in these affected areas of small bowel. So as a result of which, because of ulcer formation, there is poor absorption of the nutritional products or nutritional ingredients, and there is chronic pain and also malabsorption. So because the intestine is affected, the products are not getting absorbed properly, there is diarrhea also. So the most common symptoms in a patient with Crohn's disease, usually the patient presents typically with history of pain, history of diarrhea and weight loss or loss of appetite. So here the weight loss is because of poor absorption, and also because Crohn's disease is a chronic inflammatory state where the body is in a catabolic state, the patient usually fails to put on weight or gradually loses weight over few months to years. So what is the common age group where we see these Crohn's disease patients? Usually Crohn's disease is highly prevalent in the age group 20 to 40 years of age, whereas ulcerative colitis is also common in this age group, but it also has bimodal presentation where we see another peak in 60 to 70 years age group also. Whereas Crohn's disease, usually in our clinical scenario, we diagnose Crohn's disease at around 15 to 30 years of age, where the patient presents with the symptoms which I have mentioned before: pain, diarrhea, and weight loss or loss of appetite. So how do we come to a conclusion that patient has Crohn's disease? So whenever the patient is a suspicious case of Crohn's disease, we advise few investigations which help in confirming the diagnosis of IBD or Crohn's disease. So what are these investigations? When it comes to simple blood tests like laboratory parameters, it can be as simple as blood counts or inflammatory markers like CRP or ESR, which are definitely elevated in active Crohn's disease individual. When it comes to visualization of the lumen or visualization of the intestine, it can be by endoscopy or it can be by an imaging, which is a CT scan or MRI investigation of the abdomen. So when it focuses on our intestine, it is called enterography or enteroclysis. So these are the investigations which usually we perform to label the patient suffering with IBD or Crohn's disease. So in addition to these tests, sometimes at the onset of diagnosis, usually to monitor the response of the patient to further treatment, we also order a stool test in which we measure what is called calprotectin levels. So these levels are usually elevated in a patient with active Crohn's disease or active IBD, and thereby once the patient is put on treatment, we serially monitor these levels to assess the response to treatment. A patient is a good responder to the treatment, the levels of this calprotectin that decrease over the period of few weeks to months after the initiation of treatment. So now what are the options what we have to treat this Crohn's disease? Treatment is both medical and surgical in cases of Crohn's disease. So when it comes to our medical management, in addition to improving the general nutritional status of the patient, in addition to advising high protein diet, because good intake of protein always improves in healing and always improves in ulceration reduction as well as mucosal healing in case of active inflammatory bowel disease. And in addition to this nutritional advice, what we give is anti-inflammatory drugs, which can be salicylic acid derivatives, or sometimes there can be immunosuppressants also, because we must understand that Crohn's disease is because of heightened immune response of the intestine. That is the reason this inflammatory bowel disease is happening. Because of this heightened response of the intestinal mucosal layers or intestinal epithelial layers, the intestine is affected with development of ulcers over the period of few weeks to months. So that's how in treatment also we advise immunomodulators, that is the drugs which keep this immunity under check. So therefore the healing of the intestinal epithelium or healing of these ulcers occur over a period of few weeks to months after starting these immunomodulators also. So in addition to this medical management, sometimes there can be need for surgery also. When is this scenario occurring? Sometimes active Crohn's disease, in addition, even though if patient is put on continuous monitoring and treatment, some patients they tend to progress, they tend to worsen clinically, and also they tend to develop complications. So in such scenarios, there can be a development of stricture formation, in which nowadays with the endoscopically, if the stricture is localized to one or two parts of the small bowel, we can still dilate that narrowed part of the intestine using this balloon, which can be done endoscopically also. But diffuse involvement, I mean involvement of multiple areas of the intestine sometimes can present with intestinal obstruction also, which is a serious condition which requires hospitalization, and if required it requires surgery and resection, that removal of that affected part also. So these conditions are the ones which require surgical intervention. In addition to this stricture obstruction, the other complications which occur in a patient with Crohn's disease are perianal fistulas or abscesses in case with active Crohn's disease. So, there lies the importance that whenever we see a case of unhealing or non-healing fistula or abscess, we always tend to look for any underlying inflammatory bowel disease, more so Crohn's disease. So, this highlights the importance of ruling out IBD conditions in a patient with recurrent or unhealing perianal fistulas. So, coming to the complications part, last but not the least is long-term Crohn's disease, which is poorly controlled. If not under proper control, over the period of long term, patient can develop serious malnutrition, and usually patient stands at a higher risk for sepsis and severe infections, and this can result in mortality as well.